Thank you for joining the First Unitarian Universalist Church of Houston for our weekly online Ministers Forum. I'm the Reverend D. Scott Cooper, Assistant Minister of Congregational Life, filling in for Dr. Bosson. These forums were created to disseminate online science-based resources during the pandemic, and we have talked to community organizers, artists, scholars, religious leaders, and medical professionals about collectively addressing issues as they surfaced. Our very first guest on the Ministers Forum was Dr. Kim Waller, and as we bring the online forums to a close, we wanted to bring her back for an update. Dr. Kim Waller is an Associate Professor of Epidemiology at University of Texas School of Public Health in Houston. She has over 30 years experience as an epidemiologist and 7 years of experience as a labor and delivery nurse. The opinions that she gives today are hers alone and have not been endorsed by her institution. She has been a member of First UU Houston for over 25 years. So, Dr. Waller, thank you so much for joining us.
Thank you, Reverend Cooper. It's a delight to be here.
I'm so excited we were able to have you back. You've made such worthwhile contributions to the forums all along.
Participating in these forums has been a great experience for me. It's given me a chance to do some research and put my ideas together.
So today we're recording this on June 21st, 2021. We like to say that because new information comes out daily. We're now 15 to 16 months into the COVID-19 pan-epidemic. So what's the situation in our area now?
The situation is good. I'm going to show some data on that later. But first, let me mention that, as you know, recently the CDC director, Dr. Walensky, announced that if you're fully vaccinated, you no longer need to wear a mask indoors. People in this area are dropping their masks. I noticed that in the Walgreens I frequent, people are not wearing masks. And here at the School of Public Health, many people indoors are not wearing masks because we're fully vaccinated for the most part. I will note that we do not do patient care here in this building. Otherwise, we'd probably still be wearing masks.
Yeah, I still, in the grocery, most people are wearing masks. There's a few people who I notice aren't wearing them. And when I walk outside, most people are not wearing masks. So that's about the extent of my getting out right now still.
Yes, when Dr. Walensky made that announcement, I think a lot of people were shocked. And a lot of people I know did not want to drop their masks. They weren't ready to drop the masks, but the vaccine does work.
Well, that was going to be my next question. How effective and how safe are the vaccines? And what percent of our population has been vaccinated?
Vaccines are very safe. And if you're fully vaccinated, they are 95% effective, which means they are almost 100% effective. If someone who is fully vaccinated does become infected, the infection is almost always mild and does not result in hospitalization. Before we go on with the forum, Reverend Cooper, I'd like to show a few slides with some data I downloaded from the Texas State Health Department. I just want to go quickly through these slides. In slide A, I'm showing the number of hospitalizations of people with COVID each day from the start of the epidemic to now. So on the far left is the number for the start of the epidemic, and on the far right is now. And you could see two very obvious peaks in the epidemic. The first big peak was last summer, where we had almost and this data, by the way, is for Harris County and the surrounding area. So specific to Harris County and surrounding counties, including Fort Bend. And we had a big peak last summer with almost 3,000 COVID patients hospitalized. And then we had another peak just this December and January, again with about 3,000 patients hospitalized. Where we're at now is 450 patients in hospital with COVID in this area. And then in slide B, I'm showing you the number of new cases from the start of the epidemic to the end of the epidemic in Fort Bend County and in Houston, Harris County, Houston. Harris County, Houston has 4.7 million souls or people living in it. And Fort Bend is quite a bit smaller, 811,000. So Harris County, Houston is 6 times larger. And you see the same epidemic peaks in the number of new cases. And then finally, in my last slide, which is slide C, this is kind of the punchline, is what is happening now? So now I'm focusing in on the number of cases in a recent 2-week period, which I chose was June 1 to June 14th in the current month. So looking at the new cases of COVID in Harris County in that 14-day period, there were a little bit over 2,000 new cases. And that worked out to an average of 149 new cases per day. And then in Fort Bend County over that period, there were 537 new cases, which worked out to an average of 38 new cases per day. So this will give you a feel for how many cases we're having right now. And then you can make rates out of that. And the reason I'm giving you the rate is because you'll see it a lot. And to get the rate for Harris County, you just take 149 cases, divide it by 4.7 million, which gives you a very tiny number. And then we multiply it by 100,000 to get the rate per 100,000. And so for Harris County, the rate of new cases per day per 100,000 is 3.2. And for Fort Bend County, the same rate is 4.7. So actually, even though they have fewer cases in Fort Bend County, it's a smaller county, they actually have a higher rate for that 2-week period. So that's what it looks like. Probably more data than most people want to see. but at least you know how many cases there are out there.
Yeah, I find that really interesting. Well, it sounds like a no-brainer to go ahead and get the vaccination, but we hear of people who are still skittish about it or afraid of it and lots of things. So what are some of the groups that have lower rates, and do you know why?
Overall, in Texas, around 50% of people have had 1 or 2 shots. The group with the highest rate of vaccination is older people my age and older, so 65 and older. Among this group, 90% or more of people are vaccinated. So it seems like people understand their risk, and they understand they're in a higher risk group, and the older people and probably the other medically vulnerable people are getting vaccinated in high numbers. Also, Blacks and Hispanics are slightly less likely to be vaccinated. There's a particular concern about undocumented people. So people who are residing here in the US, but they may not have legal documents. Now, I tested this out by going to Walgreens and asking the clerk there about it in the pharmacy. You get the vaccine in the pharmacy, and you just walk in, it's free, no appointment needed. And she said, all I need to vaccinate someone is a passport or a driver's license. And then I write the number down. So I think she wasn't looking to be concerned as to whether somebody was legally here or not, but she needed a number to write a number down.
Now, people who watch the news, I know, have been hearing tell about this new Delta variant. Is that something that we need to be concerned about?
The Delta variant is spreading rapidly in the United States and other countries, and it may be more lethal. So it is indeed a concern. This week, there was an outbreak in Florida of COVID-19 in an office building. I think 6 people working on the same floor were infected, and unfortunately, 2 of those people who were relatively young died. because of the nature of this quick outbreak and the lethality of it, there's concern that the outbreak may be due to the Delta variant. So stay tuned to see whether or not they confirm that that was the Delta variant. However, the good news on the Delta variant is that the vaccines, in particular the Pfizer and the Moderna, I think there's less data on the Johnson & Johnson, but in general, the vaccines are very effective against the Delta variant. So the Delta variant is another reason for everybody to get vaccinated who is not yet vaccinated.
I've also heard on the news that the hospitals are seeing people who are coming in believing and ending up being infected are almost invariably people who haven't had the vaccine.
Sure.
Which stands to reason, but you would think people would be picking up on that by now and using that as even more reason to get the vaccine if they haven't already.
You know, prior to the epidemic, only 50% of people got the influenza vaccine. So we have a real problem with vaccine literacy in this country. And I think UUs could step in there because we have so many educators. I mean, we could develop curriculum to teach people about previous epidemics, smallpox, polio, rabies, all the things that we have vaccines against, that we don't live with those things anymore because of vaccines.
Yeah, exactly.
We could teach vaccines. I think the UUs would be good at it.
Well, we're good at a lot of things, so I have to agree with you.
Yeah.
So I want to totally shift gears right now. And the other thing we hear on the news is people going back and forth about the origins of the virus, and it keeps popping up in press coverage. We hear people talking about it. So, what do you know about that?
Yeah, it's an interesting story and one that I've been following since the start. And other epidemiologists, of course, would be following it too. Let me start with what is the standard theory of how new respiratory pathogens arise. So the standard theory for many years has been that these new epidemics for respiratory infections arise from animal populations. Bats are real important in the story because bats carry viruses. Viruses don't seem to make the bats ill, and they just carry lots of viruses. For instance, you might know that bats carry rabies, but they also carry coronaviruses and lots of other viruses. So bats are one animal that carries viruses. There are other animals that carry viruses. And in past epidemics, we've actually been able to match the genetic code for the virus causing the epidemic to a population of wild animals. They've actually been able to make that link and prove that the epidemic derived from a population of wild animals. So that's always been a strong theory, and we haven't, no one's been able to show that the novel coronavirus is linked to a population of wild animals. They've been trying, they've been looking, but they haven't found that. So that, but nonetheless, Dr. Fauci and other leading people always said that would be, that was most probably the origin of this, and they continued with that. However, these particular pandemics started in Wuhan. And in Wuhan, it turns out there are two very large buildings that are big laboratories where coronavirus research is being done. And one of them, at least, is very close to the market where we initially thought the outbreak was centered. And so many people thought that was a big coincidence. Why did the outbreak start in Wuhan? That was the question. It was not we were not expecting to see an outbreak in Wuhan, and the outbreak was in Wuhan, and the outbreak was close to two big labs that study coronaviruses. So people who study viruses are called virologists, and they get samples of viruses from bats or other places, and they bring them into their lab and they grow them and they study them, and they often do it under high containment. I'll go ahead and ask for slide D here, which shows a high containment laboratory. It shows a Chinese researcher working in her high containment laboratory. So they're trying very hard to prevent the viruses from escaping the laboratory. And how would they escape the laboratory? Is usually they would infect a laboratory worker. So all the workers have to make sure they don't get infected, because if you get infected, you may take it home. So they've been working in these high containment laboratories, growing viruses. This work has been going on all over the world, particularly in the United States, but also in China and some other countries. And they do experiments in these laboratories. And one of the experiments that they do is called gain of function research. And I'm not going to go into the details, but basically what they've been doing for a couple of decades now is they will take a virus that is not able to infect humans. So it might be a virus they found in bats, but it's not a virus that can infect humans. And then through manipulation, they will make that virus able to infect humans. They will cause that virus to mutate. Viruses mutate all the time. And the end of the experiment is to cause the virus to be very infective, have a very high potential to infect humans. Now that may seem like a strange thing to be doing. The reason, their stated purpose is to know what mutations need to happen for the virus to infect humans, and they thought that would help them prevent a pandemic. So that's gain of function research. And that research, ethical concerns were raised by groups of scientists in 2013. And as a result of those concerns, the Obama administration paused funding for that research. And then the funding was resumed after a committee was set up and they put more guidelines in place. That funding was resumed in 2017. So this is just overlaid on the fact that there are coronavirus labs in coronavirus labs in Wuhan. Overlaid on that is the concern about gain of function research and research that causes viruses to be infectious to human beings where they weren't before.
Wow. So the proximity of the market to the laboratories and the fact that they haven't been able to find it in any wild animals have led people to put two and two together and kind of suspect that's where it came from.
In slide E, I'm just showing you the name of just one of the articles. There's a number of articles out now, but this is one that was published in the New York Magazine. The lab leak hypothesis. For decades, scientists have been hot wiring viruses in hopes of preventing a pandemic, not causing one. But what if? So this person wrote a very readable, it's long, but it's readable. His name is Nicholson Baker. He wrote this article, and he does seem to be leaning towards the lab leak theory. It's a provocative article, but he goes through a lot of the different scientists involved in this and how they, the Chinese scientists have been collaborating very closely with the US scientists. So it's not like China's doing this and we're doing that. There's a lot of collaboration, a lot of international collaboration, sharing of ideas. And so, yeah, it's getting to be kind of a hot topic, the lab leak theory. Now, I don't know for sure. I have been one, I'm not one who analyzes the genetic sequences, so I can't get deep into that. But to me, it did seem, arising in Wuhan so close to the laboratories, it seemed like a coincidence, a big coincidence.
Sure. Well, you talked about how the bats carry these things, although they don't make them sick. I've read about Bat Boy in the National Enquirer, but now we're hearing about the Bat Lady and how she is involved in this. Tell us about that.
Unfortunately for the bat lady, whose name is actually Dr. Shizi Honglei, and she's affectionately known as Bat Lady, she was the scientist in the picture I showed you of the high containment laboratory. And unfortunately for her, she's getting a lot of the press on this directed towards her and her lab because she's a very prominent scientist. And what she's been doing for years is she will travel to the far west of China where there are caves with certain types of bats. She gets samples of their blood, their saliva, their fecal pellets. She takes it back to her lab and isolates coronaviruses. And then she grows these coronaviruses. Exactly whether she's doing gain of function or what research, I don't know. But she was quoted when the epidemic broke out, very soon after, somebody interviewed her, and she was quoted as saying, "When I heard about the epidemic in Wuhan, I was very concerned and I rushed to my lab. And I went through all the coronaviruses that I have in the lab. She sequenced them. She has the genetic code already. I went through all the genetic code of the coronaviruses in my lab and compared it to the genetic code of the COVID-19, and there was no match, and I was very relieved." But you see, the fact that she was rather concerned in the first place, again, makes us concerned. And if there is a lab leak, it's not necessarily from her lab. There are other labs that are working on coronaviruses there. But
Sure.
that is what she said. Now, she's gotten kind of irritated lately. And she said something kind of angry on social media. I don't need to repeat it. Of course, she speaks English. It was in English. But, you got to feel for her. She's a serious researcher, and it's all kind of coming down on her at the moment. She's always been the bat lady. She's always been famous for that and well regarded. She says she is sure this is not a lab leak. So she's coming out strong against the lab leak hypothesis. And another thing you may hear is that people are saying, well, it's come out that there were 3 researchers, I think they're saying in her lab, who got sick in November, 3 lab workers, and they went to the hospital with COVID-like symptoms. Now that is a rumor. Nobody's been able, they're printing it all over the press, but nobody's been able to document it. And she's actually did a really good job of refuting it. She said to one of the reporters, well, give me the names of those 3 workers, please, because I don't know anything about it. And nobody could give her the names. Now, if it did occur, I also read in my travels that in China, people are more likely to go to the hospital for things that are more minor. And even if that did occur, it could easily have been influenza. So to me, that's not a smoking gun that 3 people got sick. But at first I thought, kind of interesting. But I don't think that really proves much. And nobody seems to have the documentation. Of course, the government of China has not been forthcoming.
Well, I think just the fact that she went back to the lab and compared that to make sure it wasn't something rather than covering everything up immediately speaks well to her, and the fact that she doesn't have something up her sleeve, it would strike me.
Well, yeah. I mean, she was concerned. Yeah, but it's yeah. That's true. That's a good take on it, Scott.
So politically, like you said, rumors fly and people talk. Politically, how's this going to affect our relationship with China?
That's, I think, was one of the concerns probably at the beginning why people didn't want to leap to the lab leak idea. I don't know what's going to happen with our relationship with China, but my message is, and a lot of scientists are saying, don't blame China. Whatever happens, we don't want to blame China. Because even if this were to prove to be a lab leak, we were funding this research. it's the US that funds this. It's our researchers are over there training their researchers. They're all collaborating. So everybody's doing this together. So we can't, whatever happens, we can't blame China for this. I think we can blame China, the Chinese government, for not giving more. There was a World Health Organization report, and they went over to China, and they weren't given access to much. We could blame the Chinese government for that. They are known to be, more careful about what they give out, and they haven't given out much that could convince people either way. But we don't want to, blaming China could be very bad. As you use, we are interested in peace and cooperation with China. We don't want to do anything that would help increase anti-Asian hate crimes. So no, we're not blaming China for this. It really would come back on, in my mind, it would come back on the US who funded it and the scientists who've been promoting this for years. And again, I don't know that it is a lab leak, but somebody pointed out, and I think it's a very good point, that suppose we prove it's an animal reservoir for this, the origin of COVID-19, we still should be questioning this research. Because this research, 100 very prominent scientists wrote to the Obama administration complaining about this research. There are scientists really raising the flag, and that was long before COVID-19. So the question is this research really going to help stop an epidemic, or is it going to start an epidemic?
Well, like you said, I think people need to be hesitant when they go to blame people. It's the old biblical adage: let he who is without sin cast the first stone.
Yeah, that's a good point.
And like you said, it's just horrible that this has given rise to anti-Asian hate crimes. It's just you see these people getting beat up on the news. It's horrible.
Oh yeah. Yeah, and I think things are a little bit better now that Biden is in office. So I think that's one reason that we're looking at the lab leak theory more now. Scientists feel a little bit more comfortable about bringing it up now because Trump was manipulating it so much and talking as if the Chinese did this on purpose and it was some sort of attack. It was crazy. Why would the Chinese want to kill their own people? If it happened, it was an accident, right? And they wouldn't do something like that on purpose. So
Right.
it was just.
So we're about to run out of time, but I want to end up by you telling us what lessons that we've learned from the last 16 months. How should we approach life in the post-pandemic period that hopefully we're now entering?
Yeah, I've been mainly thinking of gratitude. The first thing I think of is my gratitude list, which I think as an American, I need to be grateful for free vaccines and incredible access to vaccines. I'm also grateful to the healthcare providers, especially ICU nurses, ICU physicians, respiratory therapists, and others. And finally, I'm grateful to the young people under 40, because they have really been amazing. My students, they've been so careful, wearing their masks, and they're doing it to safeguard the health of older people and vulnerable people, and their lives have been totally disrupted. So I am very grateful to that younger generation. So I'm thinking we're learning gratitude, for one. And then I have a scientific lesson. And this is really kind of, most of what I said is research. This is my own idea in a way. I think other people will be talking about it. We experienced a tremendous drop in cases of influenza during the last year, almost dropping to just way down. And also many people report they didn't get colds. I didn't get colds. So respiratory infections, other respiratory infections, apparently due to social distancing. So I think that teaches us that influenza, we haven't been able to prevent it. It causes deaths every year. The vaccine for it doesn't work great. People don't like to take the vaccine. But it looks like we maybe could prevent a lot more cases of influenza if we would stop shaking hands, which I believe, that moisture on the hands, and then you shake someone's hand and then you just want to touch your face. That is a real transmitter of germs, shaking hands. Stay home when you're sick. Businesses, let your employees stay home when they're sick. And then looking more at ventilation in certain buildings. I mean, I think there's a lot of things that we could take from this pandemic that might help us reduce respiratory infections. Now, I might be being overly hopeful here, but imagine a world without influenza and with many fewer colds. What an amazing world that would be.
Absolutely, absolutely.
So the other lesson people are going to be talking about is remote work. I mean, that's been coming for a while, but we're going to be looking more and more at the benefits and some of the downside of remote work. What do you think the lessons are? Scott, do you have anything to add?
I think you hit a lot of really good ones. I think we've learned a lot about ourselves and how much we depend on being with one another. I certainly had no idea how hard it would hit me not being able to be around people. Well, and I talked about this in my last sermon. The isolation, I think, just hit a lot of people really hard. So, but I think people are grateful, more grateful now. They realize how grateful they are for their families and their friends.
It's a good place to end on.
Yes. Well, you were talking about you use spreading the knowledge about these things. You've certainly been a huge spreader of good information through these forums throughout this, and I just really can't thank you enough for doing this a couple times with Dr. Bosson and with me today. So thank you so much.
Doing these forums has been fantastic for me too. It's really kind of helped me.
Great, great. So, for those of you who were with us on the Ministers Forum for the first time, let me say a few words about Unitarian Universalism. We are a religious tradition that celebrates the possibility of goodness within each human heart, the transformative power of love, and the clarifying force of reason. We believe that we need not think alike to love alike. We hope that you find these forums a source of connection, hope, and clarity. If you found this video to be helpful, please consider joining us for our weekly worship service. Our live stream services begin on July 4th, and we will begin meeting in person on July 11th. You can still watch our previous video services and ministers' forums on our YouTube channel. Thank you to our staff for making this video possible. It was produced by Christian Holmes. Alma Viscara assisted with the editing. We will see you all online soon and in person as soon as it is possible for us to gather together again. And please remember that no matter how isolated you feel, we are all in this together.